funds as a handout, I'm getting those tax dollars that I have shipped off to Washington returned to me and invested in my community to serve my residents. And so that's why I think, at least in one part, the census is important to us. All right, here's some things I've heard. So I'm going to shift over to the topic that has consumed about 99.9% of the oxygen in most rooms over the past 8 weeks or so, and that's COVID. And here's some things that I've heard in Bell County over the past few weeks. One of them is that there's some people that believe that if you shouldn't buy Corona beer because of the coronavirus. Those are the same people who think chocolate milk comes from brown cows, also, I think. Obviously, this is false. Both of those statements are. I've heard, don't pop the bubble wrap in your packages because it comes from China and the air inside will give you coronavirus. That's also not plausible or viable. And then the second or the third thing I've heard is that the coronavirus is a hoax and that 5G cell towers actually cause the illness and that it's related to the 5G network. All of those things I've heard in one way, shape, form, or fashion from different folks. So here's some of the questions that I get, and I've been getting on a regular basis about COVID-19, and I'll offer a little bit of commentary on it too. But one of the primary question that I've gotten probably over the whole event is, why are we doing this? This is no different than the flu. It's just one big hoax, or it's one big conspiracy. That one political party or the other has conspired to put all this out there, or that the government has conspired and is trying to do X or Y or Z, whatever it is. So here's how I've been answering that. The median hospital stay, and I take it from a flu versus COVID-19 perspective. The median hospital stay for a COVID-19 patient is 12 days. If you get the seasonal flu and you have to go into the hospital, it's 3.6 days. The fatality rate for COVID-19 is about 3.5%. For the flu, it's 0.1%. But the big factor, and the reason I think the federal government, the CDC, state government, and the State Department of Health have made such a big deal of all of this and instituted all of the orders that the governor has issued, has been this one, which is the hospitalization rate. And the hospitalization rate for COVID-19 is 10 times what it would be for the flu. So what that means is, if you get COVID-19, the chances of you being hospitalized are 10 times greater than the flu. And it's particularly true for one segment or multiple segments of our population, of the general population. And I'll come back to this, and I want to show you some state statistics and some Bell County statistics that I gathered from the local hospitals to show why this hospitalization rate is important to us, not just at a national level or a state level, but also at a Bell County level. And that's the source for that information that came out about a month ago now from the CDC and the New England Journal of Medicine. Okay, probably all of you have seen this, which is the dashboard that the Texas Department of Health and Human Services use. It's updated daily. I just did a screenshot of it from yesterday. They are updating it as we speak right now. Probably the new one is already online, but this is yesterday's as of noon, and they do it at noon every day. Whole bunch of information on the slide. You scroll down over here to get to Bell County, and it's in the center of that slide there. But what I want you to look at is something that's a little hard to see on those on the website, but it's that little arrow right there where I put the red circle. They used to have tabs across there. I don't know why they did away with those. I wish they'd put them back. But now they have these little circles or triangles that you click on, and it advances some slides for you, and it goes into detail for you. So one of the things I look at every day is I look at this website, and I just kind of look at it big picture to kind of see what the total tests are, number of cases, active cases, Bell County count, all that kind of stuff. But then I click on that little triangle there, and when I do that, I go to a couple of places. One of the places I go to is this slide, which is the hospital data broken out by trauma service area. And Bell County is in Region L, which is the center of the state right there. It makes up about 7 counties, I believe. And you'll see the population for trauma service area L is 490,000. You probably know that Bell County's population is probably approximating or getting close to 400,000. So we are the lion's share of that population in Region L, or trauma service area L. The thing to look at there, and the thing that the governor has been honing in on as he opens up more of Texas, is what is our hospitalization rate and what is our hospital capacity. And the hospitals are already ordered to reserve 25% of their capacity in the hospital for COVID patients. But if you look at those numbers for our region, and that's primarily 3 facilities, Baylor Scott and White Temple, Advent Healthcare Systems, Colleen Lampasas, and Seton Medical Center in Harker Heights. There's some other medical facilities in the count, but those 3, just like on the population number, make up most of this capacity that you see here. So what does that say? Well, it shows that right now, as of yesterday anyway, there were a total of 930 beds available in the hospital system in service area L, and 390 were available. So that means about 600 or so were occupied, but they still had 390 that were available. And even more important from a COVID standpoint is the number of ICU beds that are available and the number of ventilators that are available. And then the last one there is the number of patients currently in the hospital that are COVID patients, and you see that number at 12. So if you see 12 here, now not all 12 of those are in ICU beds, and not all 12 of those, excuse me, are on ventilators. But those are important numbers that the governor's office in particular and DSHS have been watching to make sure that we don't have a spike in the number of cases for COVID that overwhelms the available bed spaces that we have. So that's an important slide. Again, it's one I look at every day just to kind of see, and I look at that ICU bed count and the ventilator count and the number of patients actually in the hospital. And what that slide tells me is we got plenty of hospital capacity. That's not an issue for us. And I think the governor is seeing the same thing on a statewide basis. This is another slide. Again, when you click that little triangle down there, you can go to all these slides. On this slide, the one that I look at is those numbers there, primarily, which is available ICU beds and available ventilators, and that's for the whole state of Texas. And I think that's what the governor is looking at as he issues these orders that allow businesses to open up more and more, because he's seeing that there seems to be adequate bed space for ICU and for ventilators. And then there's another slide on that same website that you can go to. And this is the other thing that the governor has mentioned more than once in his press conferences as an important data point that he looks at as he makes decisions. And that's the total cases reported. So this bottom half there is a cumulative slide, which means that every day there's a test made or a test reported, that the next day that bar graph goes up because there's just more tests. And the only thing that can ever happen on the right end of that bar graph is that it just flattens out. In other words, we just stop doing testing. But it's always going to be growing until we stop testing. What the governor has looked at is what he's calling the positivity rate, or the rate of total tests taken against the rate of positive tests that come back. And if you look at that top chart, what you see since about April 24th, April 25th, is that relative to the number of tests that are done, the positive rate of those tests, even though there are more tests occurring, the positive rate of tests that come back have pretty well flattened out. Now, it doesn't mean there's not, more people being tested positive. It just means that the rate is pretty constant, so that we know if there's 100 tests given that, and I'm going to make up a number because I don't remember what it is, but that there might be, 10% of that, or 10 of those that test positive. Whereas, and if you test 200, then it would be 20. And if you test 300, then it's going to be 30, and so forth. And that's, I think, what the governor is seeing is that that positivity rate remains pretty constant. And I think that's another thing he's looking at pretty closely. All right, so let me hone in on Bell County. This is the Bell County Public Health District website for COVID-19. If you look at that website, there's a bunch of information there. We intentionally patterned it after the state website so that people get hopefully a comfort level of the data points that are presented. There's a lot of data there. I'm not going to spend much time on anything except for that box right there, which is the Bell County cases by date tested positive. And that's the one that I look at along with the hospitalization rate and those that are admitted to ICU, because that goes back to our hospital capacity. You know, do we have enough of those? And you remember what that slide before showed for the region, for service area L. But on this slide, if you look inside that red circle, and I made reference to this yesterday at the press conference, you'll, in my read of that is that since about April 16th, I think was the date, which is when that first 8 started, and you look across there, we have been pretty much at 8, 8, 8, 8, 4, 7, 7, 9, 5, 8, 1, 5, 3. That tells me that it is flattening, or at least it has since April 16th. And while we still get new cases, we're not seeing 20 new cases a day, or 30 new cases a day, or 40. We're seeing pretty much the same numbers or less a day. So that's what I meant by, I think it's flattening somewhat in Bell County. Now I'm going to come back to this toward the end of my comments because I think we got to watch this pretty carefully over the next week or two. And I'll come back to that in a second. And as of yesterday, we've run over 9,000 tests in Bell County. So lots of testing is going on. There are multiple locations that you can go get tested if you're symptomatic. And again, our healthcare providers addressed that point yesterday also. All right, let me localize all this just a little bit more. And this information is a couple or 3 weeks old, but it's I didn't update it for today. But some of it doesn't need updating. But right now, Baylor Scott and White in Temple has 636 beds, by far the largest healthcare provider in the county. And they have a variety of beds at that hospital. So they have obstetrics beds, they have newborn ICU beds, they have pediatric ICU beds, they have psychiatry beds. The point being is that not every hospital bed is equal. In other words, they're there for different reasons. And, you know, for example, you couldn't put an adult who needs an ICU bed into a pediatric ICU bed. It wouldn't work. It's not the same equipment. It's not the same setup. So again, just because there's 636 beds doesn't mean that's available for every person who needs an ICU, needs a bed. There are also what they call adult med surgical beds and adult ICU beds. And those are real important, especially when we're talking about COVID. Pre-COVID, our hospital occupancy rates were running about 90% for an adult ICU bed. So think about that for a second. 90% of the beds were occupied before COVID. And really what the hospital administrators tell me, and I talk to them every week, is that the adult med surge and adult ICU beds were actually running closer to 95 to 100% pre-COVID. And in fact, there were many weeks during the year when they don't have any ICU beds for adults and they have to move them to another facility outside of the county. So what that tells you is the availability of adult med surge beds and adult ICU beds is razor thin in our healthcare facilities. They don't have a lot of excess capacity. And the analogy that I use when I talk to folks about this is think about the airlines before this event anyway. When you got on an airplane, almost every seat was taken. There was no vacant seats. They just didn't have a lot. They had shrunk all their capacity down for efficiency purposes. The hospitals have done the same thing over the years, and it makes them more efficient, but it means that there's not a lot of capacity there, a lot of excess capacity. So the current availability so this was all pre-COVID. Once COVID came around, once the hospitals were told to reserve capacity, once you and I were told to social distance, wear a mask, practice good personal hygiene, all of those kinds of things, then this is what happened. And I'll just click on all the bullets there. The baseline for ICU beds at Scott and White and Temple was 70 before the event. On April 13th, they had available beds of 24. And what that means is you kind of have to do a little bit of math here, but if they're occupied 90% of the time or 95% of the time, pre-COVID, they only had about 3 beds at any given day. Well, as a result of the measures that were ordered and taken by the hospitals and by Bell County residents, the hospital was able to increase its adult ICU beds that would be available to 24. Well, that's a huge increase from 3 to 24 before the COVID event because of the measures that were taken. So when you hear people talk about, and so that's my answer to why did the federal government, why did the state government, why did the CDC, why did DSHS, why did the local public health district make such a big deal about trying to flatten the curve, is that they didn't want a whole bunch of people getting really sick at one time and needing to go to the hospital and needing an adult ICU bed. Because if that happened, we don't have enough beds. And there'd be a lot of people that would not be able to not be in the hospital that need to be in the hospital. And this is just a snapshot of Bell County. It was true across the entire state. And you saw it play out really in New York when they did have a surge and they did not have adequate hospital capacity. Okay. Another question I get quite a bit is, when will this end? When is this going to be over? I sit in on weekly calls with the federal and state officials. They all talk about models and forecast, and think about those kind of like hurricane model forecasting. There's a whole bunch of models, and depends on which one you pick. It gives you the dates as to when things will peak and when this will be over and all that kind of stuff. I also have at least weekly calls with the 3 local healthcare provider CEOs of Baylor Scott and White, Seton, and Advent, and their chief medical officers. And they give me an update on what they're seeing at their hospitals. And I've been inviting them to the press conferences or representatives so that they can talk specifically about their hospitals. But here's the short version of what they're telling me. What they tell me is the numbers for Bell County are really too small for any good forecasting. So, we can't really predict with any accuracy when Bell County will see a peak or when it will end, because we just don't have a big enough database. And by a big enough database, they want millions as opposed to thousands of numbers. And so that's one reason. The other thing they tell me is that because our numbers are so small relative to the database they'd like to have, any increase or decrease can significantly impact the model that they run. So they are hesitant to, again, forecast at a Bell County level. All of that said, they think that we're in it right now, that May 7th to May 15th is probably the peak period for Bell County. Now, they also stress, and really stress it over the past few days since the governor's last order, but it's really important to watch our numbers over the next week to 10 days. With all the businesses that are opening up now, as authorized by the governor, there's going to be a flood of people out and about and businesses open that were closed. And so there's some concern by the health authorities that that this peak period that we should be in right now may not be the peak as a result of all the openings. Now, they also say if everybody continues to practice good social distancing, good personal hygiene, wear your mask when you're in densely populated areas and you can't social distance very well. If we keep doing all those things, then maybe we won't see a rebound or a second peak, so to speak. But that's really important over the next week to 10 days, is to watch those numbers. So what's the path forward? I mean, what do we need to be doing in a big picture sense? I don't know. That's my short answer. The response that we have had for this pandemic has been unprecedented. The federal government, state government have never reacted to a pandemic the way they reacted to this one. And we've had other pandemics in our history, but none of them got the reaction from the health authorities that this one did. I do think the last culture shift that occurred for America was 9/11, and that event changed America in many, many ways. I think we're going to see another culture shift for the country as a result of COVID-19. Just as transportation and the way we travel and think about transportation changed after 9/11, I think health care and health protocols are going to change going forward. They're not going to be what they were before this event because of what our health authorities are now recommending. I don't have any idea what that's going to look like in the days ahead, but I believe it's going to be different than the days that are behind us. I do think these social distancing protocols are now going to be embedded in every next response to the next new virus, whatever it is. So I think we can all probably get used to social distancing and face coverings and washing hands and all those kinds of things, which I'm not saying are bad necessarily. I'm just saying that's going to become, I think, part of our culture now as we deal with whatever the virus is going forward. Really, though, the path forward is above my pay grade. I've mentioned it several times, but I don't really think it's a federal call. I think they can provide guidance and issue recommendations, but I think from a legal standpoint, I think it's the state call, and more specifically, the state has vested emergency management power in the governor, and he is definitely making the calls. But I'll tell you what I would do if I were king. If I were king, I would say what I need the federal government, the state government to do is identify a policy that look at the virus, look at the health threat, and then identify who's the most at risk in our community, and then apply quarantine policies to them and protocols to the population. But I would not quarantine the entire population, assuming they are at very low risk for hospitalization, much like the flu. Most of the population, and I showed you on that previous slide, in fact, I think it was 0.1%, are hospitalized. Well, if the risk to the general population of hospitalization is very low, well, then let's not necessarily put quarantine measures in for them, even though they can spread it, and ask them or require them to follow some health protocols, and then quarantine those who are at high risk for hospitalization or for a higher mortality rate. That to me makes more sense than quarantining the entire population and shutting down everybody. I'd also give more control to the locals. I just don't believe that either Washington or Austin knows Bell County better than Bell County. I think if they give us the data and the information and the policies, then we can decide when and where to apply those policies. Meantime, what I'm telling everybody is keep washing your hands. Don't go out unless you have to. Practice the social distancing when you do go out, and wear your face mask when you can't practice social distancing, good social distancing. I guess I would add to that, which I did yesterday at the press conference. But again, the governor is the guy in charge, and follow his orders. I mean, whatever those are. I'd also was asked to talk a little bit, and I'll try to go real quickly through these so we got a little bit of time for questions if there are any. The impact on businesses. This just came out from the Better Business Bureau just a few days ago. And they did some survey work or had commissioned some of that. And it just shows that, nothing surprising here, I don't think, but that 70% of the businesses says there's a very significant negative impact on them. I even think that number might be low. I think it might be higher than that. And that impact is in those boxes there you see on the left. That half of them said the biggest challenge ahead for them was cash flow, just paying bills and staying in business, being able to keep operating. Customer demand, 25%. Employees, just able to keep employees, pay employees. I've got another slide I'll show you here in a second about that. But that's, again, that's hot off the press in terms of what businesses are seeing as significant issues on them relative to COVID. This is information just got yesterday, as a matter of fact, for Bell County and Texas unemployment rate and unemployment claims. So if you look at the top box there, you'll see that as of yesterday, and the reporting period is through May 2nd, that the unemployment rate is 4.7. And then that box, and everybody believes that number is pretty low, and that the next report that comes out, it's going to get higher and higher and higher. And I'm in that camp. I think our unemployment rate will be double digit for sure. But if you look over at the right side there, the top 5 unemployment insurance claim industries that are impacted, no surprise that restaurants workers have been laid off. Dentist offices have laid off a bunch of people. Schools, that one's a little puzzling to me, but nonetheless, schools are on there. And then frozen specialty food manufacturers are also the top 5 unemployment claims that are being received in terms of workers. And then on the bottom there, I've given you the Bell County information from the same report with that workforce. And you see our unemployment claimant count is 11,000 and a 4.9%, a little bit higher than the state average, at least as of May 2nd. And then you see the top 5 that are listed there. It looks almost identical to the list across the state, except for the 5th one, which are beauty salons. And that apparently we've got a number of those in Bell County, and that made the top 5 list anyway in terms of unemployment claims for Bell County. There is guidance out there for individuals and businesses in terms of health protocols. As the governor has reopened the state, DSHS, which is Texas Department of Health and Human Services, has issued, I think it's 33 different documents that give protocols for a variety of businesses, retailers, individuals, employers, on what they should be doing for minimum recommended health protocols. And all I did was cut and paste off of the website that you see right there, dshs.texas.gov. /coronavirus/opentexas.aspx. If you go to that website, you can click on any one of these and you'll pull up the protocols for that particular business or that particular area. It's a very good website. They update it very frequently as May 18th. I'm sorry, effective May 18th, but I mean the last update I think was just a few days ago. I can't remember what day it was. I also just did a real quick survey this morning and just put 3 up here. I think there's probably more than this, but places to go for assistance in Bell County if you've been impacted by COVID-19, if you're an individual or a business for that matter. Hill Country Community Action, and there's the website address for that, but they have received, I want to say it's around $700,000 for emergency disaster relief for COVID-19 pandemic. You can go to that website. You'll see the criteria for making an application for those monies and how that and who's eligible and those kinds of things. Same thing with the city of Killeen. They received, I want to say, around $600,000 or so that was made available, and they've put up a program. And again, you can go to that website there at the city of Killeen for further information about assistance for water bills or rental assistance. And then the bottom one, City of Temple, they haven't published it yet, but they told me this morning that they would be publishing information and posting it on their website about a utility assistance program for individuals who may have been impacted by COVID-19. So those are 3, again, just a couple of the cities and Hill Country Community Action. And I know there's more out there, but I just for the sake of time, I just put those three up on the screen. At the federal level, the two that I would highlight for you is the Paycheck Protection Program and then the Economic Injury Disaster Loan Program. I won't go into a lot of detail about all of those. I'm not as familiar with those programs as maybe some others are. I know that they have had some funding constraints, even with the trillions of dollars that the federal government has made available. I think one or more of those programs may have been tapped out, but I've also been hearing that they're going to issue another round of funds that will be available. And again, the first one there, that Paycheck Protection Program, is a forgivable loan program if there's money available in that still, but a forgivable program where it helps employers meet payroll for up to 8 weeks. And if they use the money for payroll, rent, mortgage, interest, or utilities, it's not paid back. So it really is more of a loan, a grant, not a loan. That's my last slide, which I say we will get through this. I think there are happier days ahead. It's hard to forecast the impact, the economic impacts at the moment, because we just don't have enough data. Most of the sales tax information, property values, all of that kind of stuff trails significantly in terms of time the event. And so it's going to take us a little while before we can really assess how long and how deep we go in terms of the economic recession that I think most everybody believes that we have entered into. With that, I will be happy to try to answer any questions, and I'll try to get back to the screen that I need to go to. Are you there?
Can you hear me?
I can hear you now.
Okay. All right. So that was a question that was asking about, according to the slide, you were saying, do those numbers reflect the adequate doctors and nurses across Texas of each hospital, or just the beds and ventilators available? I know there's a bunch of slides. I don't know if you remember which one, but is there something that shows about the numbers of doctors and nurses across Texas if it's needed?
I have not seen that in terms of, I'm flipping back through my slides right now to see if on the state dashboard they have identified number of doctors, number of nurses, number of healthcare workers. I don't think they have. The comments that I have heard from the governor's office is maybe one of the reasons they're not tracking that. I mean, the governor issued some orders early on that allowed for, nursing students, medical students, interns, those whose licenses had expired, needed to reapply, those kinds of things, to allow all them back into the workforce. I've not heard the state indicate in any briefing that I've been in that there is a shortage of doctors and nurses right now. And I've not heard that from any of our healthcare providers in Bell County. In fact, some of our local hospitals have indicated they have had to idle some of their healthcare workers, doctors and nurses, because they have not been busy enough.
Okay, got you. For those that are in the room, again, we thank you for being here. We are actually on live on YouTube. So we're doing YouTube live as well as in the Zoom. So again, thank you, Judge Blackburn, for being a part of IBCC's Zoom, which is called I Am Innovation, which is information advancement meeting. And we'll definitely open our doors anytime you want to come on, and give any updates within the county. We can definitely make Ask the Judge a permanent fixture to where you can reach out directly through the chamber to a demographic of people that need the information. So again, I think Ask the Judge could be definitely permanent in going forward. So mi casa is su casa as far as that goes. So we have an additional platform for you. And if we don't have any other questions inside, either on Facebook, either on YouTube or within the Zoom call, which I don't see any right now. But again, thank you for being here, taking the time out of your busy schedule to assist us with the information that was put out.
Not at all. I was happy for the invitation, and happy to present anytime you like. And again, it's I would just close by saying I'd like everybody be safe out there. Continue to practice the health protocols that the health authorities are asking us to do, and we'll all get through this. But thank you for the invitation to be here today.
Yes, sir. And then my closing remarks, using what Judge Blackburn had said, no one knows Bell County better than Bell County. So I would take that. Okay, there's a question that just popped up. All right, so this is coming from YouTube Live. The question is, how will you address the disparities in testing for residents on the north side of Killeen? The Bell County is reporting 30% of Black people have COVID-19 and only 24% of the population of Bell County.
Yeah, and I appreciate the question. The north side Killeen comments that I made were relative to the census information, not the COVID situation. So that's the first thing I need to clarify and make sure you understand that the maps I was using there were when I was talking about the census. Now, relative to let me go back to my slide here so I can get the number back up. We did talk, or the health district director did speak to that question about the disparity between the percentage of tests. And I think the caller or the question, whoever posed the question, has the correct percentages as I recall, and I don't have those in front of me. But I think there was about a 6%, 7% maybe deviation between the population and the testing. And I think, and I don't want to put words in the health district's director's mouth, but I think from her perspective, that was not a significant deviation. And I tend to agree with that in the sense that if you look at some other acceptable deviation ranges, look at redistricting as an example, which I mentioned in the presentation relative to the census timeline. When we redistrict, we've got to balance, there's a rule, a law that requires us to balance the districts. And you really can't do that precisely. There's no, even though you want everything to be perfectly balanced when you redistrict lines, it never works out that way. And the courts have recognized that and said some deviation from that perfect balance is acceptable. And the deviation factor or allowance in redistricting is 10%. So you can be 10% plus or minus and still be within an acceptable range of deviation. Now, I don't know that applies directly to a health situation. And so I would just have to rely on my health authorities to tell me if any deviations there are either statistically significant or medically significant. And so far, they have not advised that deviation is either of those.
Okay, sir. Thank you, and I appreciate that. Looks like that is all of the questions. So again, in my closing remarks, we know our families better than anyone knows our family. That is caveated off the statement that Judge Blackburn has said, no one knows Bell County better than Bell County. So no one knows our family better than anyone else than us. Monitor your homes, monitor your businesses, and monitor yourself. Be very cautious, be very vigilant, and be blessed. Again, thank you for being here, a part of IBCC, I Am Innovation, which is information advance meeting here on IBCC Zoom. So again, we'd like to thank you for being here, Judge Blackburn. We'd like to thank those that are on the YouTube Live, and definitely thank those who are on or active participants within our Zoom call. And if you need anything from us, Judge Brown, please do not hesitate to reach out. And again, tell it to the judge would definitely be a permanent fixture. If you would like to definitely reach out to us, and if you have more information, by all means, the phone number that you called today is the Chamber's phone, as well as the email that you have been emailing when we had made this connection. This is the email that you can reach out or make that phone call. So again, tell it to the judge is a permanent platform for you, sir.
Thank you.
All right. So make sure if you go to the Innovation Black Chamber of Commerce website page, for those who are not familiar with what we do here, go to innovationbcc.org and give us a call if you need us. Phone number is 254-415-9951, 254-415-9951. And make sure you check your emails, because there is a constant contact email that will be going out within the next 20 to 30 minutes. You guys be blessed. And remember, tomorrow is another day